learning together, developing together, and practicing together. And when you do that, all you need to do is ask yourself a few questions as well. These are quality check questions to tell you that your community of practice is practicing and developing and learning together. For example, how rich and accessible are the community's knowledge and representation, knowledge representations for the existing practice? So, are they doing webinars? Are they doing trainings? How good are these? How impactful are these? So, these are the kinds of questions that you ask yourself ongoingly to make sure that your community of practice is learning, developing, and practicing together. Is your community of practice taking an action together as a community? And here you have to ask yourself, are there collaborative efforts happening between even individuals within this collaborative community of practice? What are these initiatives? Are they impactful initiatives? So these are the kind of questions you ask yourself. And then you ask, is my community of practice creating knowledge or not? So there are quality check questions here, like, for example, to what extent is the research that is coming out of this community of practice impactful? Is it cited? Is it needed by people? Is the research that is generated here answering to actual existing questions that exist in the community? These are the quality check questions. Is it different when our communities of practice are in healthcare teams? Yes, a little bit. Because, each member in the healthcare team relies on the other to execute the quality of care, as we say. The focus here, especially in the healthcare team, it has to be on the quality of the service and not on the quality of the individual practice inside the quality of practice. Otherwise, this will not be healthcare, as you all know. So you focus on collaborative skills, but take care. People also have to develop trust and confidence in this community healthcare team. Otherwise, people will not be able to take responsibility, and we will fall into a problem of extreme adversity that happens in healthcare teams. So take care. You have to always be addressing any adversity in the team. If there is any cultural issues or communication issues that you have anticipated because there is adversity in the team, you had better plan ahead for it. And of course, take care. As any team and as any group, there will be personal differences that develop. You have to be ready to start dealing with these personal differences exactly like you would do in any conflict, or as we call it, difficult conversation in our Famer Fellowship program. Take care. One important issue is creating collective leadership. And this is so important because collective leadership is not about a person leading and everyone following. It's about everybody leading towards a target. It's very hard when people are coming from different walks of life, and also people are coming from different cultural and educational backgrounds and educational focuses to create this collective leadership tendency inside the community of practice. But you have to work hard on it, and it is something that you have to invest in. So now that we are going virtual, what's going to happen? Very easy. You have to keep quality checking. And when you quality check, you have to take care that you're quality checking two things: the processes that are happening and the product that is happening. When we're quality checking the process of our community of practice, you have to take a look: are people committed or not? Is the communication and collaboration that is going on, is it real, or has it turned into a virtual level where people don't even know each other and they're just communicating like any chat function on any virtual platform? So it has to be real. And is it continuous, or is it something that is just time bound? This is the process. So whenever you are following up your process, just ask yourself these questions. But take care, whatever your community of practice is producing also has a product. And in order to make sure that your product is one good product, you have to ask yourself, is this product authentic or not? Is there quality to the research, or to the paper, or to the webinar, or whatever it is we are doing? And at the end, you have to ask yourself, is learning actually happening or not? Because people tend in virtual settings to stop the learning and start putting on a show. So you have to make sure that your objectives, your intended learning outcomes, have been achieved at the end of your initiative. I just want to draw your attention to a piece of work that we have just developed. It's on MedEd Publish. It's called Emerging Faculty Needs for Enhanced Student Engagement on a Virtual Platform. This piece of work was based on a case study that we worked on. And at the end, it came out with a very important recommendation that people, faculty specifically, like all of you, need to start working on developing a little bit more their educational, their training needs. So we need to focus a little bit more on establishing new training needs that have to go with this virtual world that we are going to. It's no longer just about technology. It's more focused on how we adapt our teaching strategies to the technology. There is a sharp difference between both. And this sharp difference is the focus of this paper. You can scan and go see it. And we want to invite you all to start thinking more about your strategies and how you're going to adapt them to the virtual world in order to maintain this building of the community of practice that is the core value of what we are doing. I also want to draw your attention to something else, another piece of publication. It's also on MedEd Publish, called Step-by-Step Guide to Creating Competency-Based Assignments as an Alternative to Traditional Summative Assessment. And why am I talking to you about this piece of paper at the moment? Because at the end of this paper, there is a matrix. I want to invite you to take a look at this matrix. And this matrix is a matrix that you can do whenever you are working with any deliverable at the level of undergraduate, postgraduate communities of practice like this. And this matrix, it actually helps you, it shows you that you can map whatever it is your objectives on one side, and on the other side, you can map the tasks or the assignments that you are giving your community of practice. And you take a look at these, at the areas like these are independent areas where people have to work together without your close focus. And there are other areas that are not actually within your designated skills or designated objectives. These are the areas that really need your support. So mapping out your objectives, as we do in this matrix, it helps you identify areas that will really need you to be a part of the discussion and a part of the communication with your community of practice. If you don't map them, you don't see them, and they remain areas that are blinded and areas where people drop out from your community of practice. So mapping is the first step towards making sure that your community of practice is all that you want it to be. Thank you so much for having me today. I will stop sharing my screen and over to Imran.
Um, Thank you, Samar ma'am, for such a wonderful lecture. And I think you have emphasized the need for improvements in the way we assess our students at this point in time when COVID has taken over, and also emphasizing the need for the virtual communities. And in fact, because I have been part of one such virtual community where we have been able to do a lot of good work, and I have been coming to know a lot of good work done by various other people. In fact, a lot of work done by the Ancient University and by yourself. And this was a short introduction which we had planned so that our people get used to it and get to know most of the works what we are trying to do in the field of health education. And I would like to thank all the people who have joined for today's lecture, especially Animesh. I can see Dr. Animesh sir had joined from Nepal. I can see Dr. Ibrahim Nagnoor, who's the preventive oncologist and who's working in our college, who has joined. And in fact, I would see a lot of interns who have joined for the program. Probably I think they have gained a bit. And Dr. Shambat sir, who is our vice principal, and I can see our alumni, Dr. Mahmood Mutadat, who's working in Qasim University. He has joined, and in fact, he was ready from yesterday to join for the program. I would like to thank him, who has taken his time out and joined for the program. Basically, we have a senior faculty from our college who have joined for this program, uh, right from the junior level to senior level faculty. The assistant registrar of the Nepal University has joined. Uh, in fact, I would like to thank each and every one of them who have joined and who have listened to the lecture. I hope they have got some insights into the work what we do at the Famer Institute, and also the effect what we are trying to create in the education system. Thank you all for joining for the program. I would like to request everybody to fill the forms for e-certificates. E-certificates will come in directly into your mail. I'm again putting in the chat box. Everybody can fill these forms for getting the e-certificates. Sama ma'am, thanks a lot. Thanks a lot for coming. And I know it's early in the morning for you, and giving us the directions. I leave the platform open if anybody has any questions to ask Dr. Sama. Dr. Sama ma'am, for any of the points which you are not able to follow, or anything you want to communicate to Dr. Sama. You can open the mic and you can address Dr. Sama. Okay. Yeah, since I think most of them are new to this. Most of them are trying to understand this component. Uh, I would like to thank you, ma'am, for joining us for the program.
Thank you,
And
Dr.
if you,
Amran. This was really enlightening. I just want to tell you that this is my first time to use Google Meets. It's quite a nice application actually. So thank you for having me. And I think Amran, you
yes,
you have my email, and if at any
yeah,
point of time anyone would like to communicate, I am happy to answer questions over email. Thank you.
yeah, yeah. Thank you, ma'am. Thank you. Thank
Thank you. Have a great day. Bye.
you. Yes. Bye. And